Hello, Ppcr team. We are group 12 and we are going to discuss case study 18 about recruitment of study participants. So Dr. Angela Nasser is a pediatric endocrinologist passionate about juvenile diabetes, and she's planning a phase 3 trial testing a new intervention that is called Immune D for the treatment of type 1 diabetes in young people. But the problem is that she is aware that the recruitment is very fundamental in a study, but is often neglected step in clinical trial.
In Dr. Nasser's city, Florianopolis, only about 50 children are diagnosed with diabetes each year. So her main issue is finding an answer to the following question: what would be the most appropriate strategy to define the population and advertise the recruitment process? She's mainly concerned about the recruitment process, especially for the large study she's planning, about 500 patients. It might take several decades to enroll enough patients, and also she might be concerned about the eligibility criteria because she has to find a balance between external validity and internal validity.
Well, the first stop is at Rio de Janeiro. So it is proposed by Dr. Márcio Correia, and he advises her to choose a broad-based recruitment strategy through TV, email, internet, radio, printed forms. And this choice is based on the premise that they are dealing with a phased trial, and the generalizability and external validity must be reached. This way, this strategy could help to reach a more heterogeneous population.
The second step on Dr. Nasser's trip is in São Paulo. She met Dr. Paulo Costa that suggests her a targeted strategy in hospitals and outpatient clinics, sending invitation letters to physicians to search the target accessible population. The advantage of this approach is the lower cost and provide relevant population. The disadvantage is that the number of referrals could be low to reach the sample size.
The third stop at Belo Horizonte, Dr. Nasser consulted Dr. Marcia Mota, who is an endocrinologist passionate about diabetes, and she advised her to reach physicians through medical local societies and ask for their approval and support to raise awareness of the study among physicians and even patients through their websites or small public campaigns. This option is very easy to perform, cheaper, and more reliable.
So Dr. Nasser should consider in first place the type of patients that each strategy can yield. A broad recruitment strategy can bring in patients that may not be included in the end. Also, Dr. Nasser needs to consider the changes in recruitment times and probable loss of power that each of these strategies can have.
In conclusion, we believe that recruitment will depend mostly on the phase of the clinical trial we're dealing with. For example, phase 2 trials would benefit more from targeted enrollment strategies since it preserves homogeneity, thus increasing internal validity. On the other hand, on phase 3 and phase 4 trials, we will deal with a larger sample size, focusing on enhancing generalizability and increasing external validity. In these phases, we believe that broad-based recruitment strategies are a better approach. Thank you.